The phrase "I'm so OCD" is used a lot, and generally it means something like, I like to keep my kitchen a certain way, or I like my clothes to be organized a certain way. It's very nonspecific, and it's used by people to mean a lot of very lighthearted things. I think it's important that we stop doing that. And the reason is because it's really harmful to the mental health community and to people who suffer from obsessive-compulsive disorder specifically. Very briefly, OCD, obsessive-compulsive disorder, is a very severe, debilitating disorder, and the diagnosis for OCD requires that you meet criteria that are very specific. Those criteria include obsessions, or compulsions, or both. And there are really particular specific definitions for the symptoms of obsessions and compulsions. Obsessions are recurrent and unwanted thoughts, images, and impulses. Generally, they cause a whole lot of distress for the individual experiencing them. Compulsions, on the other hand, are repetitive behaviors or mental acts that an individual feels driven to repeat over and over and over again, generally in order to reduce the level of anxiety that they are experiencing. Generally, or very, very often, the obsessions and compulsions are linked to each other. This disorder, OCD, is difficult to treat, although it can be treated. It is very painful to live with, and it tends to be chronic and often debilitating for the person suffering from it. It is entirely different from the tendency a person might have to be particular about how they organize things, or even perfectionistic. We will discuss in another video the concept of obsessive-compulsive personality disorder, which is not OCD, but is something I think people also get confused about. So, going forward, try not to say "so OCD," unless, of course, you really do have OCD. Thanks. I'm Dr. Wendla, and this is my channel. If you like, please like and subscribe. Thanks.